everybody, I'm Dr. Amy Crain from Inver Chiropractic, and I want to talk to you guys a little bit about how we see families in our office. So throughout pregnancy, we like to see moms to help with labor and lots of other things, but then we also encourage moms to get their babies checked out after they have the baby to make sure that there's nothing going on there. Now, with the birth process, it's very traumatic for mom and baby. So 9 times out of 10, we find that babies have some sort of upper cervical fixation, or what we call a subluxation, where there's something structurally wrong in that upper cervical spine that needs to be relieved. So it might not affect the baby right away, but there can be things down the road that can occur due to these subluxations. So I always encourage moms to bring their babies in to get checked out. So in our office here, we do a couple different things, but the main thing is the history and consultation with the mom and the baby to figure out, you know, how the birth process went for you, what different things happened, all the stressors that possibly could have gone on prior to bringing the baby in, and then also what kind of symptoms the baby's having, along with checking neurological things like their reflexes and developmental stuff along the way to make sure they're on track. Now, the biggest thing in our office we do, though, is the actual adjustment, the chiropractic adjustment. So I'm going to show you on my son. There's a couple different ways we adjust depending on how they react. So my son is almost 11 months old, so he's getting pretty mobile where things can get a little bit more difficult to adjust, so we always alter it. But this is Caden, my little test dummy. So we adjust manually in our office using our hands, but then there's also different ways. So I'm actually going to check out, can you take that from his mouth? I'm going to check out his pelvis today because that will be the easiest to show you guys. So we like to assess the hips and make sure everything's where they need to be, especially at this age, because Caden is walking, which causes a lot of different falls to happen. But I know, buddy, his one hip is off, so I'm going to show you how we adjust that pelvis. It's just a very gentle, light pressure.
Say it's nap time.
With a little vibration.
What's that?
To help put some mobility through there. Usually he thinks it's really funny. Good. So that was an easy way that we adjust the pelvis. I'm also going to check, if he'll let me, his upper thoracic area. So why don't you sit and face Daddy?
Oh, yeah. Boom, boom.
So he has one right here, and when I push, he actually arches his back, which tells me it's a little uncomfortable. So this is the activator, which Caden has. It's another gentle way to adjust. It uses a very low force, and it uses vibration to put motion through the actual joint there. So it vibrates the joints and then puts it back to where we want it to be. So I put it to a really low setting. Find the segment.
Did you find the tag? Did you find
Good. And then I just recheck to make sure things are back to where we want it. Awesome. So that's it. So that is 2 different ways that we adjust in the office and check out the spine through the little ones. And we adjust, people ask all the time ages, and it goes all the way back from, you know, minutes old to all the way up to whatever age, years down the road. So if you guys have any question regarding anything I showed you in this video, just let us know, and feel free to set up a consultation to get your little one checked out. Thanks, guys.